Hi, welcome to our Pharma Topics channel. Welcome to the series of videos related to BPharm 6th semester Pharmacology-III. In this video, we are going to see about Unit 1. It is related to Pharmacology of Drugs acting on the gastrointestinal tract. It includes 9 subdivisions: anti-ulcer agents, drugs for constipation, drugs for diarrhea, appetite stimulants, appetite suppressants, digestants, carminatives, emetics, and antiemetics. In this section, we are going to see 47 questions with the explanation answers which could be useful for your exam preparation. First question is classification of anti-ulcer agents. It is of 5 classifications. You just remember 5 classifications. First two, actually they decrease the gastric acid secretion. The drugs decreasing acid secretion in the stomach are proton pump inhibitors, omeprazole, rabeprazole, H2 receptor antagonists, ranitidine, famotidine, anticholinergics, pyrazipine, telinzipine, and potassium competitive acid blockers. These are new drugs, vonoprazan, drugs that decrease gastric acid secretion and also increase the gastroprotective factors. They are prostaglandin analogs. Only one drug is available, misoprostol. Then the ulcer protective agents, they are coating agents, sucralfate and colloidal bismuth subcitrate. Drugs that neutralize the gastric acid are antacids, aluminum hydroxide and magnesium hydroxide, and ulcer healing drugs, carbenoxolone, but carbenoxolone is not widely used. You may remember the 5 things, or you may remember most importantly 4 things. The question number 2 is a short note on proton pump inhibitors, or they may ask a short note on the prototype drug omeprazole. The drug list of proton pump inhibitors they are prazoles: omeprazole, pantoprazole, esomeprazole, lansoprazole, rabeprazole, tenotoprazole, and elaprazole. Basically, the omeprazole or other proton pump inhibitors, they are gastric acid suppressants and anti-pepticulcer agents. Proton pump inhibitors, anti-secretory agents. Mechanism, they irreversibly inhibit the proton pump, which is an enzyme H plus K plus ATPase present in the gastric parietal cells. They prevent the gastric acid secretion and effects last for 1 to 2 days or even longer. They are used in treatment of Pepticulcer disease, gastroesophageal reflux disease, Zollinger-Ellison syndrome, which is a gastrin secreting tumor, heartburns, and prevention of NSAID-induced ulcers. The adverse effects include GI disturbances, and long-term use can reduce the vitamin B12 levels, increase the risk of hip fractures, increase the risk of enteric bacterial infections such as Clostridium difficile, and it may cause pneumonia also. Drug interactions, they inhibit the metabolism of diazepam, cyclosporine, and phenytoin. The third question is related to H2 blockers. The question may be a short note on H2 blockers, and they may ask specifically about ranitidine. The H2 blockers include cimetidine, ranitidine, famotidine, roxatidine, laxatidine, and nizatidine. If they ask about a particular drug, you can write about this. It's an anti-ulcer agent, H2 receptor antagonist. It blocks the H2 receptors which are present in the gastric parietal cells, which reduces gastric acid secretion. They are used in treatment of Pepticulcer disease, gastroesophageal reflux disease, and heartburn, which includes acid indigestion and dyspepsia. The adverse effects of ranitidine include CNS effects such as confusion, dizziness, and cimetidine has androgenic effects, whereas other drugs H2 blockers are not having the androgenic effects. It can cause impotence at higher doses. The drug interactions include cimetidine is a significant inhibitor of CYP450, leading to potential for serious drug interactions, whereas other H2 blockers are not having a big problem of drug interactions. The next question number 4 is misoprostol. Misoprostol is a cytoprotective agent. It is a prostaglandin E1 analog. It decreases acid secretion and as well as increases the secretion of bicarbonates and mucus. The misoprostol is used for the prevention of gastromucosal injury from non-steroidal anti-inflammatory drug use. It's the most specific drug for NSAID-induced ulcer. It is also used as an abortifacient in combination with misoprostol, mifepristone, Adverse effects include abdominal pain, diarrhea, and miscarriage because of uterine contraction. This drug is contraindicated in pregnancy. Question number 5 is antacids. The antacid list includes aluminum hydroxide, magnesium hydroxide, calcium carbonate, and sodium bicarbonate. Antacids are weak bases that forms salt and water upon reaction with the gastric hydrochloric acid. The net result is to increase the pH and thereby reduce the acidity of gastric acid secretions. The antacids are used for the treatment of gastroesophageal reflux disease, and they promote healing of duodenal ulcers. They provide prompt relief from ulcer pain. They don't decrease the acid secretion, but they neutralize the gastric acid. The adverse effects: aluminum hydroxide may cause constipation, magnesium hydroxide may cause diarrhea. Usually in the antacids, they are used in mixture aluminum hydroxide with magnesium hydroxide. Calcium carbonate was once previously used in antacid composition. Now it is not widely used. There is a question called milk alkali syndrome. In some of the question papers, it has been asked. It is calcium with milk. It causes milk alkali syndrome, which causes hypercalcemia, renal insufficiency, and alkalosis. Syndrome is group of symptoms. You can remember these symptoms. Antacids may cause rebound acidity. When they stop the antacids, rebound acidity may occur. The drug interactions: antacids decrease the absorption of numerous drugs, acidic drugs, which get ionized in the alkaline medium, and it may form complexes with the tetracyclines. The question number 6 is sucralfate. It is an anti-ulcer agent. It's a cytoprotective agent. It is sulfated polysaccharide. It is sucrose octasulfate with aluminum hydroxide. Actually, sucralfate adheres to the ulcer holes or a pit and forms a protective barrier, which prevents acid and pepsin hydrolysis of mucosal proteins and stimulates prostaglandin synthesis. Sucralfate is used in treatment of Pepticulcer disease, gastroesophageal reflux disease, and prevention of non-steroidal anti-inflammatory drug-induced, that is NSAID-induced gastric injury. It is suitable for patients who cannot be given proton pump inhibitors or H2 blockers. The adverse effects of sucralfate include constipation. The drug interactions: it decreases the absorption of fat-soluble vitamins, digoxin, and fluoroquinolones. Seventh question is, they may ask a very short note on sodium bicarbonate. It is a rapidly acting systemic antacid, but it is short acting. It's not widely used as an antacid for Pepticulcer disease. It is used to alkalinize urine in treatment of poisoning due to acidic drugs and treat metabolic disorders. The adverse effects include flatulence, systemic alkalosis, and increased sodium load that may be troublesome in cardiovascular patients. Next is eighth question is very short note on colloidal bismuth subcitrate. It is ulcer protective agent, forms acid resistant coating over the ulcer, and it dislodges the H. pylori, which is an important bacteria which causes ulcer from the surface of gastric mucosa and kills it. Adverse effects: blackening of tongue and bismuth toxicity, which may occur as osteodystrophy and encephalopathy. Question number 9. They may ask a very short note on anti-H. pylori drugs. There are two regimens. One is triple therapy. You can remember with the code name CAP, clarithromycin, amoxicillin. If amoxicillin could not be given in case of penicillin allergy, metronidazole can be given with proton pump inhibitors, especially lansoprazole for 2 weeks. Quadruple therapy: it is tetracycline, metronidazole, lansoprazole, and colloidal bismuth subcitrate for 2 weeks. Question number 10 is classification of drugs used in constipation. They may ask a question like this, or they may ask directly classify the different laxatives. There are 7 different groups of laxatives. First 3 are luminally active agents. They are bulk forming drugs such as dietary fiber, BRAN, psyllium, and methyl cellulose, and luminally active agents which are osmotic laxatives such as saline laxatives, magnesium sulfate, magnesium hydroxide, sodium phosphate, and non-digestible sugars such as lactulose, lactitol, sorbitol, mannitol, and luminally active agents which are surfactants called as stool softeners. They are docusate, liquid paraffin, and mineral oil. And stimulant purgatives, which are bisacodyl, sodium picosulfate, senna, cascara, and castor oil. Prokinetics are 5-HT4 agonists, such as prucalopride, dopamine agonists, D2 antagonists, metoclopramide, domperidone, and macrolides such as erythromycin. And there are chloride secretory agents such as lubiprostone, linaclotide, and opioid receptor antagonists such as methyl naltrexone and alvonepane. So this 7 classification you remember, it will be very useful for your attending the 5-mark question. Question number 11, they may ask a short note on dietary fiber or BRAN. It is a laxative, it's a bulk purgative. BRAN is a residual product of the flour industry. It contains cellulose, lignin, gums, and pectin. Dietary fiber supports bacterial growth in the colon, which contribute to the fecal mass. It is the first-line approach for most of the patients of simple constipation and is useful in cardiac patients when straining of stools has to be avoided. The adverse effects, they are unpalatable and it may cause flatulence. Contraindications, it should not be given in patients with gastric ulcerations because of stenosis and the possibility of fecal impaction. Next dietary fiber, question number 12 is ispaghul or plantago. They are bulk purgatives. They contain natural colloidal mucilage, which forms a bulky gelatinous mass by absorbing water. It is fermented in the colon, increases the bacterial mass and softens the feces. It is used in irritable bowel syndrome with predominant constipation, that is IBS-C, and chronic diverticulosis. The adverse effects include it is unpalatable and flatulence can happen. It should not be swallowed because of esophageal impaction. Actually, it is available as a powder that should be taken with water. Question number 13 is lactulose. It is a laxative. It is an osmotic agent. It is a combination of fructose and galactose. It increases the water content, softens the feces. It is metabolized by the colonic bacteria to fatty acids that lower the colon pH, converting ammonia to ammonium ion and reducing ammonia absorption and the blood levels of ammonia. It is used in treatment of constipation and treatment of hepatic encephalopathy caused by excessive ammonia production in the liver. It can cause cramping, abdominal distension, and flatulence. Question number 14 is DOCUSATE. They may ask DOCUSATE or dioctyl sodium sulfosuccinate in the question paper. Shortly, it is called as a DOS. It's a stool softener. It's a surface active or detergent agent. It facilitates the hydrogen of the fecal material and softens the feces, but it does not promote the peristalsis. It prevents constipation, including constipation caused by opioid analgesics. It can be given along with stimulant laxatives. It is used for treatment of fecal impaction. It may be given as rectal enema and relief of hemorrhoidal and anorectal discomfort. So useful in surgical patients. Question number 15 is a bisacodyl. It is a stimulant laxative. It may be short. In short answers, they may ask bisacodyl. It's a stimulant laxative. It inhibits the fluid reabsorption in the colon, increases luminal pressure, and stimulates peristalsis. It causes bowel evacuation before colonoscopy or surgery. It is used in short term for the treatment of acute constipation, including constipation caused by opioids in combination with DOCUSATE. It may cause cramping, nausea, fluid and electrolyte depletion, particularly hypokalemia. A short note on question 16 is a short note on sodium picosulfate. It's very similar to the bisacodyl. It is a stimulant laxative hydrolyzed by the colonic bacteria, irritates the gastric mucosa and activate the myenteric neurons, increase the peristalsis. It is used in bowel evacuation before colonoscopy or surgery, fast evacuation of the bowel in case of accidents. It can cause cramping, nausea, fluid and electrolyte depletion. Next question is a short note on lubiprostone. It's an anti-constipation agent. It's a chloride channel activator. It activates the chloride channel ClC2. It causes secretion of chloride-rich fluid that stimulates peristalsis. It is not absorbed from the gut. It's used in treatment of chronic idiopathic constipation, chronic irritable bowel disease, that is irritable bowel syndrome with constipation, that is IBS-C, and opioid-induced constipation. The adverse effects include nausea and diarrhea. Prucalopride, they may ask a short note, question number 18, prucalopride. It is a 5-HT4 agonist. It activates 5-HT4 receptors in the enteric neurons. It enhances the release of acetylcholine, which promotes peristalsis in the colon and ileum. It is used in treatment of irritable bowel syndrome with constipation. It may cause headache, dizziness, abdominal pain, and diarrhea. Question number 19, it's a very new drug, plecanatide. It's rarely asked, but you may go through it. They may ask in 2 mark. It's an anti-constipation agent. It's a CGMP increasing by guanylyl cyclase agonism. It activates CFTR, that is cystic fibrosis transmembrane receptor. It increases the chloride content of the colon. It increases the flow of chloride and water into the lumen of the GAT. It is used in treatment of chronic idiopathic constipation. Question number 20, they may ask classification of antidiarrheals. There are about 7 antidiarrheal classifications. The first most important is oral rehydration salts, which contain sodium chloride, potassium chloride, trisodium citrate, glucose and water. Probiotics, which are bacteria such as Lactobacillus, Bifidobacterium, Streptococcus faecalis, and Saccharomyces boulardii. Antimicrobial drugs are used in infective diarrhea are norfloxacin, ciprofloxacin, ofloxacin, rifaximin, cotrimoxazole, and metronidazole. The anti-secretory agents are RACECADOTRIL, bismuth subsalicylate, anticholinergics, and octreotide. Anti-motility drugs are loperamide, diphenoxylate. Absorbents are ispaghul and methyl cellulose. And miscellaneous are clonidine, crofelemer, beslotoxumab, and telotristat ethyl. So, question number 21 is a short note on oral rehydration salts, ORS. The composition of ORS is sodium chloride, potassium chloride, trisodium citrate, and glucose and water. The concentration of ions are sodium 750 millimoles, potassium 20 millimoles, chloride 65 millimoles, citrate 10 millimoles, and glucose 75 millimoles. It is isoosmotic with the blood, that is 245 milliosmoles per liter. It is used orally if the fluid loss is mild to moderate, 5 to 10% of the body weight loss. It is used orally, and intravenously if the fluid loss is greater than 10%. ORS is not designed to stop bacteria, but it can restore and maintain hydration, electrolyte, and pH balance. The non-diarrheal uses of the ORS salts include post-surgical, post-burn, post-trauma maintenance of hydration and nutrition. Next is they may ask question number 22, a short note on probiotics. It includes bacteria such as microbes, Bifidobacterium, Streptococcus faecalis, Enterococcus, and fungus mold such as Saccharomyces boulardii. These are microbial cell preparations, either live cultures or lyophilized powders, which restore and maintain healthy gut flora. It can cause a recolonization of the gut by non-pathogenic, mostly lactic acid forming bacteria and yeast restoring gut microflora. These probiotics are used as adjuncts to conventional therapy in antibiotic associated diarrhea, that is Clostridium difficile infection, acute infective diarrhea, and traveler's diarrhea. Question number 23 is loperamide. It's an anti-diarrheal agent. In many question papers, loperamide has been asked. It's an opioid analog. It activates opioid receptors in the intestinal smooth muscle, causing segmental contraction and inhibiting peristalsis. It is used in treatment of mild to moderate acute diarrhea, chronic diarrhea caused by inflammatory bowel disease, predominant with the diarrhea, that is IBS-D, and decreases volume of ileostomy drainage. The adverse effects include constipation and drowsiness. The next question is 24. Question number 24, a short note on diphenoxylate. It's an anti-diarrheal agent. It is also a opioid analog. It activates opioid receptors in the intestinal smooth muscle, causing segmental contraction and inhibiting peristalsis. It's used in treatment of mild to moderate acute diarrhea. It is important to note that it comes with the atropine. It is less, atropine is added because to reduce the addictive potential if used for chronic period. Atropine can cause anticholinergic adverse effects which can reduce its abuse because it is a opioid. Question number 25 is RACECADOTRIL. It's an antidiarrheal agent. It is a enkephalinase inhibitor. It's a prodrug converted to thiorphan, which is a delta opioid agonist. It decreases the intestinal hypersecretion without affecting motility. It inhibits the breakdown of endogenous opioids. It's used in treatment of acute secretory diarrhea, suitable for children, where loperamide and diphenoxylate are contraindicated. It can cause nausea, vomiting, and flatulence. Question number 26. A short note on octreotide. It's an antidiarrheal growth hormone inhibitor. It's a somatostatin analog. It suppresses secretion of growth hormone, insulin-like growth factors, serotonin, gastrointestinal peptides, including gastrin, motilin, secretin, and vasoactive intestinal peptide VIPs. It's used in treatment of acromegaly, severe diarrhea, and flushing caused by some cancers, and vasoactive intestinal peptide tumors, bleeding, gastroesophageal varices, and complications of pancreatic surgery. The adverse effects include arrhythmias, hyperglycemia or hypoglycemia, diarrhea, flatulence, and steatorrhea. Drug interactions, it should not be combined with anti-diabetic drugs, as this may alter the dose requirements of anti-diabetic drugs. Question number 27 is a very short note on bismuth subsalicylate. It's an anti-diarrheal agent. It's a prostaglandin synthesis inhibitor. It decreases prostaglandin synthesis in the intestinal mucosa and reduces chloride secretion. It's used for prophylaxis of traveler's diarrhea. Question number 28 is a short note on rifaximin. It's an anti-diarrheal agent. It's an antibiotic which is a rifamycin antibiotic. It inhibits the DNA-dependent RNA polymerase in the bacteria. It is useful in treatment of traveler's diarrhea, irritable bowel syndrome with diarrhea. And at higher doses, it reduces the risk of hepatic encephalopathy recurrence by suppressing ammonia-forming gut bacteria. The adverse effects include flatulence, abdominal pain, and defecation, urgency, and headache. Question number 29. They are miscellaneous antidiarrheals. They may be asked in very short notes. Clonidine is indicated in diabetics with diarrhea. Crofelemer blocks the 2-chloride channels, CFTR and anoctamine. They are used as antidiarrheals in AIDS patients. Bezilotoxumab is a new monoclonal antibody that binds to Clostridium difficile toxin B. It is used to reduce the recurrence of Clostridium difficile infection. Telotristat ethyl is a new drug. It's a tryptophan hydroxylase inhibitor. It decreases the formation of serotonin. In some of the tumors, serotonin increase. It's approved for diarrhea due to carcinoid syndrome, where serotonin is the reason for diarrhea. The next question is a short note on appetite stimulants. Classify appetite stimulants, or otherwise they may ask a question, what are Orexiants? Orexiants are nothing but appetite stimulants. They are of 4 types. One is cannabinoids, dronabinol, progestin analogs megestrol, androgen analogs oxandrolone, and supplements such as zinc, thiamine, and fish oil. Question number 31 is a short note on dronabinol. It is an appetite stimulant. It is also having anti-emetic property. It's a cannabinoid CB1 antagonist. It is used in treatment of chemotherapy-induced nausea and vomiting, which are refractory to other drugs. It's also used as an appetite stimulant in AIDS-related anorexia. The adverse effects include tachycardia, palpitation, and paranoid reactions. It's a weak inhibitor of CYP3A4, so drug interactions are possible. The next question is a short note on megestrol. It is appetite stimulant, synthetic progestin. It is used as appetite stimulant treating cachexia and anorexia in cancer and HIV. The adverse effects include GI upset, mood changes, and edema. Question number 33 is a short note on oxandrolone. It's a testosterone analog used as appetite stimulant. It stimulates appetite, promotes weight gain, useful in cases of severe trauma, infections, and surgery. It can cause GI upset, mood changes, and edema. The next question is appetite. suppressants, which are called anorexiants. Orexiant is appetite stimulant, anorexiant is appetite suppressant. The list of anorexiants include sibutramide, mazindol, benzphetamine, phentermine, pendimetrazine, and diethylpropion. They may ask a short note on sibutramine also. It's a sympathomimetic, appetite suppressant, reduces food intake, and causes dose-dependent weight loss with reduction in visceral fat. It is useful in treatment of obesity. The adverse effects include dry mouth, headache, insomnia, constipation, and increase in blood pressure. Question number 35. It is digestants. It's used in appetite stimulant tonics. The list of digestive enzymes include pepsin, papain, pancreatin, diastase, and taka-diastase. Pepsin, it's a proteolytic enzyme used in atrophic gastritis, carcinoma, and pernicious anemia. Papain is a proteolytic enzyme obtained from papaya, useful as an appetite stimulant in tonics. Pancreatin is obtained from hog and pig, contains a mixture of digestive enzymes such as amylase, trypsin, and lipase, used therapeutically in pancreatitis. Diastase and taka-diastase are amylolytic enzymes obtained from the fungus Aspergillus oryzae. It is used to treat pancreatic insufficiency. Question number 36 is carminatives. Carminatives are volatile oils obtained from traditional culinary herbs such as fennel, dill, coriander, clove, and caraway. They are used to expel gas from the stomach or intestine and is used in treatment of flatulence and colic. Question number 37 is emetics. There are two categories of emetics. One, the drugs which directly stimulate the chemoreceptor trigger zone, which is apomorphine. And the next is the drugs which act reflexly and act on the chemoreceptor trigger zone, which is ipecac. They may directly ask a short note on apomorphine or ipecac also. If they ask apomorphine, it is a dopaminergic antagonist on the chemoreceptor trigger zone. It induces vomiting within 5 minutes. It's given by intramuscular or subcutaneous injection. It is used only when a toxicant has been ingested. It may cause respiratory and CNS depression as adverse effect. Ipecac is the active constituent obtained from the dried root of Syphilis ipecacuanha. It irritates the gastric mucosa and acts on the chemoreceptor trigger zone. It induces vomiting within 15 minutes. Given by oral route, it is used only when a toxicant has been ingested. Actually, it is a household remedy. Next is classification of antiemetics. Question number 38. There are about 7 classification of antiemetics. You can remember these 7 classifications. One is antihistaminics. They are H1 receptor antagonists such as cinnarizine, cyclizine, promethazine. Antimuscarinics such as M1 blockers, hyoscine, or otherwise called as scopolamine. Then 5-HT3 antagonists, ondansetron, granisetron, palanositron. Neuroleptics, which are dopamine D2 antagonists. They are prochlorperazine. Then prokinetics are dopamine antagonists such as metoclopramide and domperidone. Then neurokinin antagonists such as aprepitant, posaprepitant, and glucocorticoids such as dexamethasone. Question number 39 is a short note on promethazine. It is a H1 antagonist used as antiemetic, having antihistaminic property and having sedative property also. It blocks H1 and M1 receptors, inhibits the activation of vomiting center by vestibular organs. It causes inhibition of the chemoreceptor trigger zone and the vomiting center. Therapeutically, it is used for prevention and treatment of nausea and vomiting, used for postoperative sedation. It's used for treatment of acute allergic reactions also. The adverse effects include sedation, confusion, and disorientation. With the CNS depressants, it may cause additive CNS depression as the drug interaction. Question number 40 is cinnarizine. It is an anti-vertigo drug. It is having antihistaminic, anticholinergic, and antiserotonergic property. It's a H1 antagonist. It inhibits the influx of calcium from the endolymph, that's the ears, into the vestibular sensory cells that mediates the labyrinth reflexes. Actually, it's a labyrinth suppressant. It's used in treatment of vertigo. Adverse effects, it may cause GI upset. The next question is 41 is a short note on hyoscine or scopolamine. It's an anti-motion sickness drug. It's a muscarinic acetylcholine receptor antagonist. It blocks muscarinic receptors in the parasympathetic nervous system and in vestibular tracts that project to the vomiting center. It is used to prevent motion sickness in adults who are traveling in vehicles, airplanes, or watercraft, and by astronauts in space. It is used for prevention of post-operative nausea and vomiting. The adverse effects include drowsiness, dizziness, dry mouth, sunlight sensitivity due to mydriasis, possibly blurred vision. It can interact with alcohol, increase the drowsiness and dizziness. The next is question number 42, doxylamine plus pyridoxine. It's an anti-morning sickness drug. It has two activities. One is H1 antihistaminic activity with prominent anticholinergic activity by causing M1 blockade. It blocks the muscarinic receptors in the parasympathetic nervous system and in the vestibular tracts that project to the vomiting center. It is used to prevent morning sickness, that is the vomiting of early pregnancy. It can cause dry mouth, vertigo, and GI upset. Question number 43 is ondansetron. They may ask a short note on 5-HT3 antagonist. It's a very important question. Pharmacological class is serotonin 5-HT3 antagonist. It blocks the 5-HT3 receptors in the gastrointestinal vagal afferent nerves, solitary tract nucleus, chemoreceptor trigger zone, and thereby preventing emesis. They have multiple uses. They are used to prevent the nausea and vomiting from cancer chemotherapy and radiation therapy. They are also useful in post-operative nausea and vomiting, and also hyperemesis gravidarum. The adverse effects include headache, constipation, and diarrhea. Question number 44 is a short note on prochlorperazine. It's an antiemetic and anti-vertigo drug. It's a dopamine D2 receptor antagonist. It's a neuroleptic. It blocks the D2 receptors in the chemoreceptor trigger zone and labyrinth suppressant. It's useful in controlling vertigo-associated vomiting and cancer-induced nausea and vomiting. Adverse effects include, which are muscle-related, muscle dystonia, and extrapyramidal side effects. The muscle dystonia is more common in children. Question number 45 is metoclopramide. In many question papers, they ask about a short note on metoclopramide. It's a pro-motility and anti-emetic agent. It's a D2 receptor antagonist and also having 5-HT4 agonism. It blocks the relaxant effect of dopamine on the gastrointestinal muscle, that is a 5-HT4 agonism. It blocks a presynaptic dopamine receptor and increases acetylcholine release and stimulation of smooth muscle. Blocks the D2 receptors in the chemoreceptor trigger zone and vomiting center and prevents emesis. It is having multiple uses. It is used for prevention of chemotherapy-induced emesis or vomiting, treatment of post-surgical and diabetic gastroparesis, and treatment of gastroesophageal reflux. Actually, it increases the lower esophageal sphincter tone. The adverse effects include drowsiness, extrapyramidal reactions, and restlessness. It can alter the absorption of co-administered drugs. Question number 46 is a short note on domperidone. It is also a D2 receptor antagonist. It's very similar in its action to metoclopramide. It blocks the relaxant effects of dopamine on the gastrointestinal smooth muscles, blocks D2 receptors in the chemoreceptor trigger zone and prevents emesis. It is equally effective as metoclopramide but does not produce extrapyramidal side effects. It acts peripherally. It blocks levodopa-induced nausea and vomiting without abolishing anti-Parkinson effect. It is effective in prevention of post-operative nausea, emesis, and cancer-induced nausea and vomiting. The adverse effects include dry mouth, loose stools, galactorrhea, drug interactions. They may alter the absorption of co-administered drugs. The last question is question number 47, aprepitant. It's a neurokinin or a substance P antagonist. It's a selective antagonist of NK1 receptors in the vagal afferent fibers to the solitary tract. Inhibits emesis induced by cytotoxic chemotherapeutic drugs. It's used for prevention of acute and delayed nausea and vomiting during initial and repeated courses of moderately and highly emetogenic cancer chemotherapy, particularly cisplatin. The adverse effects include GI disturbances. Since it's a weak moderator inhibitor of CYP3A4, it may cause drug interactions. So it's a very short information of all the drugs and all the expected questions from the GA track pharmacology. I hope it will be useful for you. Thank you for listening. Happy learning. Kindly share this to more of your friends. Kindly go through all the series of the 6th semester pharmacology and score well in your exams. Thank you.